Let me frame what we will be saying today by first saying that the President has announced a nationwide lockdown as a response to the rapid rise in the number of people infected with COVID-19. The President also announced additional measures to mitigate the social and economic impact of COVID-19. And this was given further detail by the ministers at a national level. As Gauteng province, we welcome the decisive decision by the President and the National Command Center, particularly in instituting a lockdown, because as a country and as many parts of the world, we face a threat of existential proportions. We stated last week, Wednesday, at the media briefing right here on the 18th, that what makes our province more vulnerable for the outbreak of COVID-19 are a combination of factors such as the following. Firstly, that Gauteng has two ports of entry, the OR Tambo International Airport and Lanseria Airport. And we know, as we will continue to explain, that aviation and air travel has been one of the key factors through which COVID-19 spreads. Secondly, we also, the capital city that hosts more than 130 foreign missions in Tshwane. And we know that we are the third largest size of diplomatic missions, third to New York and Washington, D.C. So this just shows how open and how much the world also is connected to our province. Our province is a densely populated province with high density human settlements, and therefore making it very difficult to have social distancing. We have large numbers of our people living side by side in densely populated human settlements, including informal settlements. We also have a mass public transit system that transports millions of people on a daily basis. So that's why, for us, the lockdown, it's going to make it easy. MEC Lesufi will deal with the social security measures. MEC Lesufi.
Thank you so much, Honorable Premier. Truly appreciate the opportunity. Ladies and gentlemen, we have prioritized 4 groups of beneficiaries. The first group that we've put majority of the resources on are what we call homeless people. These are people that are either sleeping on the streets or under the bridges and other things. So we've identified them as a group that needs to be sheltered firstly for a period of a month. That covers the entire 21 days, but also that need to be fed because they rely on begging with the number of people that are no longer available on the roads to beg from, so they might be on their own. But thirdly, which is very, very important, is to strengthen the NGOs that service them because we've got those NGOs that service this kind of constituency. So in terms of support, we are now relocating, and I will underline the word willing, unless the security cluster, as the Premier indicated, the security cluster later on advised otherwise. We are now relocating all willing homeless people into our schools. There are schools that have what we call boarding facilities, because schools are closed now. There are schools that have boarding facilities. We are now persuading, and we've managed to persuade majority of our schools that have agreed. We are now persuading all homeless people. There is a team that has gone out to negotiate or speak to them, that it will be in their interest to be accommodated within our schools. Within that context, therefore, you've got people that are in the informal settlements or people that are trapped in areas where there will not be any economic activity. for the 21 lockdown days. So we have now released 235 food distribution centers. These 235 food distribution centers are people that are already distributing food for those that don't have access to food security. So we are amplifying them in terms of their capacity. So what they're doing now, instead of providing people for a week supply, they're now giving them a month supply. And these areas are majority covering your informal settlements, your semi-rural areas in Gauteng, or where we've identified areas where children are staying alone. Then the second group that we are prioritizing are children. And these are children at risk, and we've categorized them in 3 categories. The first category is school-going children. You know, the school-going children that got school nutrition, that normally get their school nutrition. And because the schools are closed now, it's difficult to get the school nutrition. So we are converting the school nutrition into a grocery supply. So where children get this kind of food, we'll be in a position then to go and collect food in those areas. We are using the same distribution centers that we are using for the homeless to also provide. The second part is what we call dignity packs. These are children that, especially the girl child, that receive dignity packs from government. The dignity pack consists of your face cloth, toothbrush, toothpaste, to roll on, and all those things. For the very, very first time, in that dignity pack, we are now adding the sanitizers, the mask, and the gloves, so that those particular children are protected as well. That's why we say that children at risk. So we're providing those sanitizers, the mask, as well as the gloves, so that we can. Then the third category is those that are sick but at home. There are many people that are staying alone at home that are sick. So we are using community development workers. We've identified almost 3,800 that are in Gauteng, community development workers that normally visit these people. So it's not something new, we know them. They normally visit them. This time, they are carrying the support machinery that we're giving them, the groceries, and if there is a need for any other thing outside what we're providing, they will give us those particular reports. The last group, it's twofold. Let me start with the first one. There are people that normally come for our soup kitchens. You don't know where they stay, but when it's time for soup kitchen, they emerge. So those soup kitchens are going to be strengthened. But the strict advice that we've received is that this time, instead of sitting there and eating, they will only be given takeaways to manage the numbers of people that need to be there. So the soup kitchens will be strengthened. We are looking at the demand because they used to get their food between 9 and 11, but we want to introduce the afternoon leg. But based on demand, the afternoon leg will also be introduced, that we have. And the last part is shelters for abused women. We've got 24 shelters for abused women that we also want to accelerate. In my home language, they say, "Ntwakia madula moho." With people that are going to stay together for 21 days, possibilities of abuse and fights are high because "Ntwakia madula moho." So we're opening 24 women's shelters in case a woman feels that this man has changed. It's not what I fell in love with since these 21 days. I want to leave. So we've got 24 shelters that we've identified in Gauteng. And there, when they're there, they will be given all the relevant support in terms of the dignity packs, in terms of the food that we're providing.
For more, go to ewn.co.za.